The fourth theme was to improve the training and consistency of the carer. People asked, where do people find local carers, and information about where to go. They felt training of agency staff should be set to a specific standard and that this was a good idea. They felt some agencies didn't do what they were paid to do.
And in response, the first thing we've done is to implement Support Finder, which provides information about agencies that provide care to people. And the second thing we're doing is, I've talked earlier about the reports that we're going to produce about each organisation that's got a contract with us to provide care, and that will include a review of training records and staff. So that will be available as part of the reports that I've already said will be available from next March. A big issue is this issue about visits being too short for the person to be treated with dignity and respect. Treating people with dignity and respect is an absolute priority that we would expect from both the staff who work directly for me and anybody working for a care agency, or frankly for anybody providing care, whether that's from the health service or within adult social care. What we've been doing is looking at the number of 15-minute visits that take place, and we're meeting with service users to see if this is appropriate. Sometimes a short visit could be appropriate if the only purpose of the visit is to make sure that somebody is taking their medication or needs some help with their medication. However, it's not long enough if people need more complicated forms of care, such as somebody being washed and helped to get dressed. We are wanting to emphasise the importance of equality, human rights, dignity and respect, as I've mentioned already. And our contract monitoring will include a review of recruitment, induction and ongoing training and development, because we know that the people who are going to be responsible for delivering those principles are going to be the care workers themselves. We've increased the amount of feedback from users we get from our complaints process. We've also commissioned an independent brokerage service to provide support for those opting for a direct payment, and introduced the new Support Finder website to help people find the advice and the support they need in taking control of their own care and support. And we're establishing a working group which brings in providers to identify what we can do to improve the quality of care that is provided. We believe that's possible without necessarily any extra resources, just by people focusing on the best practice.